Hi everyone, my name is Dr. Kimberly Vasquez, and today we're going to be talking about leaky gut syndrome. What is it? Do you have it? Is it causing your pain, your inflammation? Maybe it's sabotaging your weight loss? Well, leaky gut is basically exactly what we said, a leaky gut. So your intestines go from your stomach all the way through to your rectum for elimination. When you eat over time foods that are processed, full of sugar, starchy carbohydrates, it can become inflammatory for your bowels. So just like when someone gets eczema on their skin, it becomes inflamed, bad things can get in there and it can cause a super infection. Well, in your gut, when it becomes inflamed, when your intestines become inflamed, every cell, which is only one cell layer thick, it's really a thin tissue, it can become inflamed and get leaky, just like your skin would on the surface of your body. And what happens is foods get into your bloodstream in bigger chunks and particles. It's never intended to go through that way. So the way I like to think about proteins is they're big, huge they're buildings. They're trucks and they're buildings made of Lego blocks. So let's use this analogy. The Legos themselves are amino acids. When you digest protein properly, it's supposed to break up into these little blocks called amino acids or Legos. But what happens when the gut becomes leaky and the food isn't broken down properly from improper digestion, then the protein gets into the small intestine as a big Lego building or truck. So this building or truck, huge protein, can go from the intestines and into the bloodstream. When that happens, the body says, oh my goodness, what is this? I don't know what this is. So it builds an antibody to it. It's attacking it. Your body is building an antibody to foreign things that come in, whether it be a virus, a bacteria, or a chicken protein or collagen protein. These big proteins, gluten protein, I know you've heard of gluten insensitivity or an allergy, it's a real thing. These proteins come into the body and your body starts building antibodies and it creates more inflammation. So yes, your inflammation can come from your injuries, your owies, different things that happen to your traumas, but can also happen because of the trauma done to the gut. This luckily can be prevented. There are things that you can take in nature that will actually help your gut get better, but there are also things that you can put in that are making it worse. If your inflammation doesn't come down, your pain is not going to go away. It's really hard to rebuild your tissues with big trucks. Your body rebuilds tissues, your ligaments, your cartilage, your bone, your skin, anything made of protein using building blocks. There's also essential fatty acids that we will talk about in a future video that are also very important in building tissues of the body. But being able to utilize the proteins that you eat in a healthy way requires proper digestion. The breaking down of those proteins actually starts to happen mainly in the stomach area. And if you're one of those people who are high stress, it's not happening properly for you. So your proteins are getting into your lower intestines and your large intestines. It's big proteins in an irritated gut, and it will leak through into the bloodstream. Now, stress is another whole different ballgame, and we will also I'm willing to talk about that in a video and how to get those digestive organs working better in a stressful situation, because stress inhibits digestion. I like to say rest and digest, or fight or flight. If you're the fight or flight, high stress person, don't get enough sleep, which is another video, then that affects your entire physiology. So your digestion is not going to be as good. You're not going to be able to eat proteins and break them down in the stomach. In fact, a lot of times people will tell me they have acid reflux, which the problem is with that is the way that they treat it, or you're self-treating, is to always decrease the proton pumps, which push out the acid in the stomach by taking these medications that stop the protein pumps that God gave you to make acid. There's a reason why your stomach is supposed to make acid. No, it's not supposed to be in the esophagus. A little bit of acid in the stomach is a bad idea and it burns. And I understand wanting to correct that. But there are ways to neutralize the acid without actually turning off your physiology. If you turn off your physiology, the digestion of protein is not happening well. Your absorption of minerals is not happening well. You don't make something called intrinsic factor, which is responsible for helping you absorb B12. So years and years and years of antacids will lead to a B12 deficiency, and we call that pernicious anemia. So this is not a good thing. Antacids were made to be used for a short period of time to get you over a little hump. You get your eating done, eating properly and digesting your food properly and sleeping properly, and those things will tend to get better. There are some exceptions, and again, that's another video. and that we can go over. Things like H. pylori, which is a bad bacteria that can live in the gut and start eating at the gut lining or the stomach lining specifically. And there's ways of treating that both naturally and, of course, with antibiotics. Which brings me to the antibiotic story in leaky gut. For those of you who have been on loads of antibiotics for over years, and just even if you took it in the past year, antibiotics don't know the difference a lot of times between the bad bug that's trying to makes you feel bad, okay, and the good bugs that live in our gut. Yes, we have good bugs that lives in our intestines, and they're supposed to live there. They live there and they help actually nourish you. So the good bugs in your intestines help break down foods further and produce nutrients. Not some of the nutrients are for your brain. So now we are talking about the gut-brain axis. For those of you who have memory fog, can't think clearly, go into a room, can't remember why you went there, those things can be related to leaky gut or poor gut health. So what I want to talk to you a little bit today, and I will be glad to do future videos on how to help your gut even more. Obviously, you don't want to continue to put bad things in your gut that's going to make it more inflamed. Sugar is a big inflammation thing. It doesn't have any antioxidants in it, and it's inflammatory not only to your gut, but to every tissue of your body. So you want to leave out sugar or sugar-like foods. Sugar-like foods like breads and cereals and processed anything that where a bag crinkles and you have to open it up and there's nothing but bad fats and carbohydrates in it and just junk. The thing about carbohydrates is we have to be careful. We used to think, oh, let's do the Daniel diet. That's great. Daniel didn't shop at my grocery store. His grains were not loaded with pesticides. Nowadays, a lot of times our grains are genetically modified and have pesticides on it. Bugs don't eat this food. That's why they do what they do. If bugs won't eat it, wouldn't that be a sign maybe it's not good for us either? And indeed can be inflammatory to our gut. The more chemicals we put into our gut, whether it be medications, pesticides, things in our environment, sprays, things that we clean the house with, all of these things are not just irritant to our gut, that's also irritant to our lungs, which again is another video. But today we're going to focus on the gut and irritants to the gut. So you want to get rid of the irritants in your gut. If you're eating a plant-based diet, I do think that we do need protein. If you're not digesting protein properly, sometimes you have to get proteins already broken up for you into the amino acids. So I do recommend a good collagen product, especially one that has been broken down into the amino acids. Bone broth is great, but bone broth comes in as a full protein and it's not broken down. So if your digestive system is on par, it's doing really well, it can break down those proteins into amino acids. All of these proteins are going to work well for you. Now, if you have a gut problem already and you're a really high stress lifestyle, and some of you will even tell me, I can't eat meat, it just doesn't make me feel good. Well, guess what? Your body is made up of proteins, a lot of collagen. You need the amino acids to rebuild. If you're not getting all your amino acids to rebuild these tissues, I can't help your disc, your ligaments, your muscles get bigger. We need all the 9 essential, yes, there are 9 essential amino acids from the foods we eat. Eating a plant-based diet, it can be done to get all the 9 essential amino acids, but it takes a lot of work and a lot of concentration and a lot of focus. And I don't know about you, but that sometimes in a busy lifestyle becomes hard to try to food combine and get those proteins out of just plants. I still like to eat fish. I like to get collagen. I make shakes with collagen proteins, and it just really helps my skin. It helps heal your gut. Collagen is really good for your gut, especially if you're getting that already broken down form. And again, you have that high stress lifestyle and you can't break down proteins well. The other thing is you need to work with your doctor to get off your antacids. Your antacids should never be used long term. They will indeed create a pernicious anemia problem, a malabsorption problem of your minerals and nutrients. And malabsorption is one thing. Some people have malabsorption so bad they don't absorb anything, and that's a different type of problem. But the problem in the leaky gut is not so much a malabsorption, is that you're absorbing everything through your intestines. Anything that you put in there can get into the bloodstream, and it's not supposed to be there in those big chunky pieces. So, leaky gut is a real thing. It can be combated with good nutrition. I will mention a couple really quick. L-glutamine is a really great intestinal healing nutrient. It's an amino acid. It's not considered an essential amino acid because your body actually makes it, but you could use some more if you have leaky gut syndrome to help that heal. Vitamin D3 is a very important vitamin, and it's really not a vitamin, it's a hormone. But vitamin D3 helps with inflammation, will help with the gut, it will help with every cell that requires vitamin D3. Most of us need vitamin D3. The statistics that I've read in a study recently said that about 80% of Americans are deficient in D3. And what I'd like to say about this is sometimes people will look at their blood work and go, well, my D3 is normal. Well, most of these people are actually taking D3, okay? Or they're getting ample amount of sun and their liver and kidneys work great because it requires more than just sun to have D3 in your body. Your body has to be able to convert it. And your liver and kidneys also have to be working well to get that full conversion into D3. That's why when we sell nutrition to people, we always recommend D3 as the form that you buy. So do not buy D2. You need D3. You want to go ahead and get the active form. And I recommend 4,000 to 5,000 units. I've never seen a day. I've never seen any one of my patients have hypervitamosis D. I've heard that is a real thing. I've just never seen it. And vitamin D3, once you're taking it and your blood levels are normal, you don't quit taking it. It's kind of like water. Once you're hydrated and all your levels are normal today, doesn't mean that you quit drinking water tomorrow. You need D3 every day. You tend to get less sick, you have less pain. So please think about your D3. Also, fish oils are anti-inflammatory. There's two parts to fish oil. There's an EPA and there's a DHA. The EPA part is the anti-inflammatory that's going to probably help your gut the most. But the DHA is essential for your brain and nervous system. So I think you need both. So I know that a lot of people were like, get more EPA or get more DHA if you have a brain problem, or if you have a heart disease, you need more EPA. Well, bottom line, whether you have heart disease or you can't think straight or you have a nervous system issue, essential fatty acids are very important, both DHA and EPA. So you need a fish oil that comes from cold water fish, not someone's farm-raised tank. Farm-raised fish don't have the essential fatty acid profile, and the fish are stressed out. If you were stuck in a little cage and couldn't move, the fish is stressed out, so some of that stress affects their physiology, and when we eat a stressed out animal, that affects our physiology, and that's another video. So I hope you enjoyed this video. Please share, and if you have any questions or any ideas or any comments, please make it down below so I can make future videos that will be educational for you. Have a very blessed day.